Okay, well, welcome back, everybody. Lovely to have you with us tonight. And tonight, what we're going to talk about is aviation first aid for onboard managers. So this is something that new managers need to know, and we're all new managers now, aren't we? We have all managed to get that hard job of a customer service manager. We've been sweating through the interviews and we finally got it. Well, now you're pretty much there. You just need to finish off this medical side of things. And I'm going to teach you a little bit about it tonight, about the management side of it and a few other things as well. And I'm just hoping that all of this technology is going to work. It seems to have frozen up on me, but just bear with me. So what we're going to do today, it's about, let's see, about a 40-minute session. And I'll give you a little bit more detail about what's going to happen in a moment. And as far as that's concerned, there's going to be a bit of a practical, there's going to be some quizzes, there's going to be a competency practical as well that I'm going to talk through. Okay. Here we go. Can you all see my clouds? There we go. Aviation first aids for customer service managers. Brilliant. All right. Now, I am a customer service manager, and I've been doing that role for about 11 years on international aircraft, big and small. And I've been cabin crew for 32 years now. And subtract 6 months, the last 6 months, I haven't been doing a lot of flying then. And I've just thought about it, and I've been in the aviation one way or another for about 37 years. So it's I spend a lot of my time up in the air. And a lot of that time, especially all the time as cabin crew, as you would all know, we have to do our refresher medical training every year. But when you become a manager, you have to learn extra things. Just 1 second. That's better. I couldn't hear myself. As managers, we've got extra responsibilities, and we have to do an extra training every year to cover that extra those extra responsibilities. So that's what we're going to be talking about tonight. Now, I'm going to go through and just ask anybody. Actually, I'll go through in the same order that I've been through in the past, starting with Peter, Carla, Gabrielle, Dino. Joe's moved up the grid. He's moved up to number 6 now. Mia's moved down to number 7, and Carlos and Nella, they're further down. So I'm just going to ask you to introduce yourselves, where you're from, and any medical experience that you may have, if you don't mind. So I'll start with Peter.
Hi, I'm Peter. I work in aged care. I'm trained to give medications to clients and residents in aged care. So the people that live in a facility, I'm trained to give them medications. I'm also trained to give them insulin as well.
Wow, you're going to be marking me, because I'm going to be doing the EpiPen tonight.
I've never actually used an EpiPen though.
Well, either have I.
I've seen one, I've never used one.
Well, this is going to be great. This is going to be great. Carla, you'll have to unmute yourself, Carla. Thank you.
Yeah, I'm on. I used to be a nurse in a previous life, so I've seen the EpiPen many years ago, used one many years ago, but happy to do a refresher. This will be good for me, so thanks for that.
Oh, good. Brilliant. I'm under pressure, aren't I?
No.
Okay, Anna or Gabrielle.
Well, you're in luck. I have no medical training whatsoever. So I'm very much looking forward to seeing this and getting to know how to use one. Thank you.
Fantastic. And Dino.
Hi, sorry about that, guys.
That's okay, Dino.
I'm a pharmacist. I've actually been trained to sell them rather than use them. There you go.
Fantastic. I'll tag you in at the end and see if we can put some business your way. Okay. Do you actually use do you sell many of those, Dino, out of interest?
Oh, yeah, you do.
Yeah.
You probably say one every week or two.
Okay. And do you sell many of the junior ones for children as well? Is
Yeah,
a
yeah.
mix? Yeah. Yeah. I wonder if it's on the rise, allergies. You'd be able to tell me actually. What do you think?
Well, typically it's seasonal, but you
Yeah.
get a fair bit happening, and it's probably more than what there was. It's probably just there's more an awareness.
Yeah. 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 That's true. That's very true. Yeah.
Mm.
Okay. Thank you. Joe.
Yeah, sorry. I am purely from engineering background. I don't have any medical experience, so I learned
Okay.
from you today.
Oh,
Yeah.
good. Good. Let's hope so. Thank you. And Mia.
I'm currently holding my qualifications of providing first aid, emergency care, all of that sort of things in accordance with my lifeguarding qualifications, and
Wow.
they are currently in date. I will be having a refresher in January though.
Wow. Okay. And Carlos.
Yeah, no, I'm pleading ignorance. I've got zero medical
So you were
training.
that. Okay. All right. And Nella, how about you?
I have done a few CPR courses,
Oh, wow.
although I don't know if I'd be able to do it if I was in that situation.
Yeah, it's
I have extensive experience in putting Band-Aids on boo-boos. Extensive, but that's it.
fantastic. No, I think it's a really good point you raised, and it kind of brings me into what we're going to be talking about, of being trained, but then actually having to do something about it in real life. Now, can you see what I've got there? Let me just move that out of the way so that the person watching can see it. What will you do? What will you do now you're a manager when there's a medical emergency at 38,000 feet? And it might not be 38,000 feet, it might be 20,000 feet when we're coming into land. So this is all about managing, right? We can do all sorts of things. We can be trained, but then on the day, you actually have to do something about it. So this is what we're up to today. First of all, before we get going, we got our safety demonstration. And I think, first of all, we've got to look at it and go, right, the most important thing today is being safe, as it always is, before we take off. And let's have a look where our exits are. So, oops, excuse me. So the exits here are over here. There might be one there. There might be one out through the window. It might be behind you. But I know for me, it's out through that door, out through the front door, or out through the back door, depending on where the fire is or whatever it's going to be. Okay, so let's just be aware of our exits. Trip hazards, those are the things, I was going to say, those are the things that trip you up, obviously, but those are the things that get you in emergencies. Everyone's rushing, everyone's going crazy, and before you know it, you're falling over and everyone's falling over on top of you, and we can't get those people out of where we want to get them out of. Again, ergonomics, we've got to be careful with that. Excuse me, my slides are moving around a bit. Ergonomics, careful how you're sitting. Might be sitting a long time today, and it's the end of the week, so you may have been sitting down at a computer all week long. Just be careful of how you feel about stuff. If you've got to get up and do some yoga or something like that, just switch your video off if you want. Doesn't matter, as long as you're safe. And if your screen's a bit bright, just dim that down a little bit. No problems at all there. So on today's flight, it's about 40 minutes. We're going to have some videos. We're going to have some activities. We're going to do some screen sharing. There's going to be some quizzes. But sounds all lovely, but I'm actually going to be quite serious, a lot of this. We're going to do some demonstrations of the EpiPen, and I'm just going to mark you on that as you do it. It's pretty simple. It's only going to be about 4 or 5 steps in that, but I do want to see that you've actually completed those as we go through. So if we can just, it's going to be quite difficult because it's quite a reasonably long session, and human nature means we lose our focus after a little while. We lose our attention, starts to drift off. It's the same person talking all the time. So just try to keep your focus, especially on those important bits. Respect each other when we're answering questions, paying attention, looking like you're paying attention as well is good as well. And questions, I love questions. If someone asks me a question, it means they actually care about learning what I'm trying to teach them. So please ask as many questions as you like, okay? And if the technology is not working, I should be able to see it. If you're saying, hey, Paul, there's no sound, or that doesn't look right, just shout out and let me know. Mobile phones, of course, if you're expecting an important call, please take the call. Don't want to stop anything. Life doesn't stop because we're doing a course. But otherwise, just keep notifications off or silent or whatever it is that you do, just so you're not constantly going from losing your attention. Now, by the time we get there, by the end of this 40 minutes, when we've arrived, we want to be able to understand the first aid policy for managers. That's us, customer service managers, trained managers, medically trained managers. The equipment that we have on board that only we can use, that other cabin crew can't use. And we're also going to learn about managing allergies and also anaphylaxis, which is severe allergy reaction. Benefits of this, when you get out on that aircraft for the first time, and yeah, you're looking great, you got the new uniform on, hey, you're a manager now, how fantastic. Be careful what you wish for. Anything can happen. So you need to be confident in what you're doing, especially with medicals, because medicals, anything can happen to anyone at any time. And there's no one way of doing every single thing because there's so many variables. So you should have some confidence in that by the end of this. Now, another benefit of it is you can prevent a diversion. If you can get on top of a medical situation, you can stop that aircraft diverting into somewhere it's not supposed to go. Sometimes you might be going into Tahiti, never been there before, that's okay, isn't it? But what about if you're going into Papua New Guinea at 2 in the morning and the plane won't be able to get out of there for another 2 days for whatever reason? You don't want that. Diversions are costly. They are so disruptive to everybody. That plane is supposed to be somewhere else. It's supposed to land in Sydney, for instance, and it's now in Papua New Guinea. That means all the people in Sydney now can't go on their holiday or on a business trip or to a wedding or something. So diversions are huge. They can happen. If medicals are the things that cause diversions most of the time, hardly ever mechanical, nearly always a medical. So it's up to you to be on point, sort those things out. No pressure. You could save someone's life as well. If you could save somebody's life, how good would that be? Has anybody saved someone's life? Anybody? You must be someone indirectly. Nah. Even people with nursing backgrounds. Nah. So people, some shy people there, I think. No. Okay. And also, as a manager, you have to let your manager know what you've been doing through the year. So you've got a couple of medicals under your belt. Happy days. So as managers, we are trained for certain situations that other cabin crew are not. Does anybody know what they might be? I'm thinking of what I'm talking about is particular medical events. So we're basically trained as crew in first aid, but there's a step up from that. What sort of things would they be? Any ideas?
What do you mean, like CPR and defibrillator?
Perfect. There you go. Heart attacks. We've got a defibrillator on board. We're going to talk about that in another session. If there's a heart attack, we will be trained as managers in using that defibrillator. Anything else? Here we go. Anaphylaxis. Severe allergic reaction. We've got EpiPens and we're allowed to use those as managers. Another thing, those are things where as managers, we have to be there. We have to be using the defibrillator. We have to be using the EpiPen, just us, not other crew, because they're not trained to use it. But in other situations, other medical situations, what would we be doing as managers? Would we be the person there doing absolutely everything? You don't think? I see Mia nodding her head. What do you? What?
I was
Go in.
shaking my head, but I feel like it's important to know your limits and your boundaries, because lots of the times I hear PAs on a phone, can we please have a doctor? So when there are more qualified people to do that, I feel like that's when you should let them take over.
Absolutely. Any other suggestions?
I think that maybe you could be overseeing it as well, like telling people what to do. You do this, you grab that, get a pillow, get a blanket, you know, that kind of thing. Being in charge.
You've done this course before now. That is exactly what we're talking about. We're talking about managing the situation, aren't we? So if we've got a medical problem and we don't have to be the one there, we've got trained crew who can be looking after that. We've got maybe doctors to look after that. We've got another role. If you are using a defibrillator as a manager, your focus is just on that defibrillator or putting that EpiPen in. That's where your focus is. When someone else is dealing with that, our focus as managers goes out. Our awareness goes right out. We're looking at the whole situation, the whole plane. Do we need to let the pilots know? Do we need to let Med-Air know? We'll talk about Med-Air in a minute. Do we need to look at the other passengers? Are they affected? Are we in the middle of a meal service? Are we about to land? Could this be a diversion for a terrorist to attack the flight deck? Are people on their breaks? Is it the middle of the night? Is the person by the window? Do we need to get them out? Do we need to get them in the galley? What do we need to do? As managers, we have to have this big 360 view of what is going on, unless we're using the defib or the EpiPen. Does that make sense? Am I scaring everybody? Does anyone still want to fly? Okay.
I don't think we can.
You can, but there's a few restrictions on it. So the resources we've got, someone mentioned this before. I think Mia mentioned it. Who are you going to call if you've got a medical that's beyond the first aid? Any suggestions?
I would call for a doctor, first of all, and anyone with any medical experience.
Look at that. Ladies and gentlemen, this is Paul, your customer service manager. If we have any medically qualified passengers who are willing to assist, can you please let a member of the crew know immediately? Thank you. And you will get all sorts come up. We love the paramedics. We love the AMBOs. Nurses are great. They're good at putting in drips. They're good at all those things. Peter would be great at that sort of stuff. I had one gentleman come up, actually surgeons. We get a lot of surgeons and they're not quite as good. They're very specialized, but beggars can't be choosers. We'll take anybody. I actually had a man come up once and he says, I'm medically qualified. I said, do you mind me asking what your qualification is? He said, I'm an embalmer. He embalmed dead bodies. And I didn't say it, but I thought maybe we'll need you a little bit later. But he did have the he was medically qualified. You know what I mean? And Dino, he's a pharmacist. He'd be handy as well. We've got a physician's kit full of stuff. But anyway, Med-Air. Let's talk about Med-Air. Med-Air is a company. It's based in America. And I like to think of it as a big medical center. In every room, we've got a specialist for every possible ailment that you could get on an aircraft. We radio them from the aircraft, say, I've got someone who's got a seizure. They'll go, great, not great. We've got someone to help you with that. They'll say, right, what's happening? This or that. You've got this in your physician's kit. We've got that in the physician's kit. Who have you got there? And they'll give us advice over the phone and give advice to the doctors as well. And they'll take legal responsibility for whatever happens. So Med-Air are absolutely brilliant. They're in Phoenix, Arizona, and they're there all day and all night. And they'll arrange ambulances, logistics, and everything. So Med-Air, if we can remember that, you might need it a little bit later. And crew are a resource, aren't they? People who've got a nursing background, people who we've actually got a couple of qualified doctors who are cabin crew as well. So find out who your resources are before you even get on the flight in your briefing, maybe. Our physician's kit, this is the one. If you've got to open the physician's kit, you know something's going on. Only the CSM, Customer Service Manager, that's us, can open this kit, okay? Only certain items can be used by us from that kit. And it contains a lot of serious drugs. Is it S8 drugs? I think it is. Is that right? S8 drugs? They're the serious ones. They've got to be registered and noted off and all of that. And of course, there's documentation, as there is with everything. You see that it's an orange bag, but it's got another blue bag hanging off the front of it. That's got stuff that we can access straight away. Sphigometers, there's a temperature, something to take your temperature as well. And the yellow thing is a sharps container. That's where you put used needles, the sharps container. Remember that as well. We're going to be using that a little bit later. Stuff that we can use from the physician's kit. Ding, Claritine, an antihistamine. We can administer that without having to ask anybody. The EpiPen that we can use. Ventolin we can use. Obviously, we need to check before we give all of this stuff, but these are things we can use once we've done the necessary checks. And the nitrolingual pump spray, which is for angina. So these are the common things that people have on aircraft, conditions people have on aircraft, and this is how we can treat them without having to get a doctor involved necessarily, straight away. And just wait for my, here we go. Allergic reactions. Dino was saying earlier on that it's quite seasonal. Would anybody like to share? Now I can't see everything about. I'm just going to go to gallery view. If you'd like to put your hand up and say if you've ever had to deal with an allergy yourself, or you've got an allergy yourself. I know it's a bit of a personal thing for some people. Oh, hang on, we've got one. Nella, would you like to share?
Very unusual allergy where I'm allergic to avocados.
Wow. And what would happen if you had an avocado?
I do believe I would stop breathing. I guess I get the tongue swells and the throat swells.
Wow, that's interesting, and we'll be talking about that a little bit later. Is there anybody else suffer from anything like Dino? Oh, I saw your microphone come up. Excuse me.
Yeah. Probably, I don't suffer from any allergies, but obviously with work, you encounter that quite often.
Yeah, I bet. And what do you sell the most of?
It'd have to be Ventolin.
Ventolin, really? Okay.
Probably sometimes they don't even know that they've actually got the problem.
Yeah, so, okay. And that's for allergies, right?
Yeah.
Okay. I saw Joe there.
Yeah. I'm allergic to sulfur, sulfur.
Okay.
The medicine comes in antibiotics, yeah.
Ah. And how did you find that out, Joe, if you don't mind me asking?
I got the swelling and I lost all the skin from my mouth.
Wow.
So then I had the test, yeah.
So it's pretty serious. Allergies can be quite serious, Any second now, something's going to come up on my screen. Just a moment. Oh, no, went too far. No. So hay fever's one. We use hay fever a lot. Hay fever's a big one. Food allergies, as Nella said, avocados, and other things as well. Now, allergic reactions come in 3 different grades: mild, mild to moderate, and severe. So let's have a look at mild. Now, these are pictures of babies. So just forget that they're babies because it just gets confusing with what dosages and things like that. But these are the basic conditions that you can get from a mild allergic reaction. So Dina was talking about the asthma, where you use Ventolin, I guess, a red itchy rash, red itchy watery eyes. That's pretty typical of hay fever, I believe. Runny and blocked nose, sneezing, another classic hay fever. Now, what would we do? Has anybody got hay fever, by the way? Nella, what do you use for your hay fever?
I use Telfast.
Which is an antihistamine, is that right?
Yes.
So that's similar to Claritine.
Yes.
Okay, and how long does that take to fix it up?
Pretty, I don't know, let's say half an hour, but if I take it every day and stay on top of it, I don't have any symptoms at all.
Wow. Okay. So let's have a look. Let's say a passenger on the aircraft says, look, excuse me, I've got these symptoms. What would we do? Let's have a look. So we'd obviously get their history, find out exactly what it is. If in fact they think it's an allergy and they've just forgotten their Claritine, or in your case, Telfast or whatever. We'll make sure for Claritine that they're over 12 years. They're not a breastfeeding mum. But we should always read the label, because there's other conditions as well. There might be pregnancy as well. So we've got to check that that's okay before we give it to them. Then we go to our physician's kit and we open that kit up. It's got a seal on it. We never leave that kit open and unattended, because it's got those serious drugs in it. We're responsible for those drugs, okay? Never let anyone near that kit if it's unattended, or put another seal on it. We've got to document what we take out, but we can always do that afterwards. Don't be tempted to do everything. Get the Claritine, get down to them, give them the correct dosage, tell other crew what you've done so they can be monitored. But we've got to be prepared for this to get worse. It could go to mild to moderate. And someone was talking about, I think it was Joe, swollen lips, face or eyes, abdominal pain or vomiting, itchy, tingling mouth, hives, itchy skin rash, sudden behavior change. Now that's just stepped up a little bit. If you go on the scene and they're like this already, you can still give them Claritine, okay? I've had hives before. I've never been allergic to anything. I was on holiday in Sri Lanka. I thought I'd been bitten by mosquitoes. I spent 2 or 3 days, and on a plane I was scratching, I was itching. I think, what's wrong with me? And then I took some Claritine when I landed, just in case, and all disappeared. And so I had no idea what I ate. It just happened. So this can happen to anybody. It doesn't have to be, oh, I've got an allergy and that's it. You can have an allergy when you're 82. You can just develop one. So it can happen to anybody. They might not know what's happening. If you get someone who's mild to moderate, we've really got to start watching them, haven't we? We're going to stay with that person. We're going to get other crew there, because it could escalate, right? We're going to get that EpiPen. So we're going to go back up. If we haven't got it already, we're going to get that EpiPen out of the physician's kit. If we've got time, we're going to contact our friends at MedAir in Phoenix, Arizona. And we're going to make an announcement for a medically qualified volunteer to get on the scene, just in case this kicks off. Because if it does, and it goes into anaphylaxis, we got to be on top of it, because it can kill people. And this is what it looks like, anaphylaxis. It can affect your airway, it can affect your breathing, it can affect your consciousness. And if these things happen, we've got a bad day. So be on the scene with your EpiPen. Now, this is from Allergy and Anaphylaxis Australia. It's just a very short video of 2 minutes. And this is what you do if you're an earthling, you're on the ground. So some of these won't necessarily apply if you're on a plane, but have a look at this. There's no sound to it. Oh, hang on a minute. Let's go again. Okay. Now you saw at the end there, it says consult the Askia action plan. I'm going to send you one of those at the end, and it's specific to aircraft as well. So what we might do now, and obviously there's some changes in that one. You're talking about lying people down. We're assuming when we're doing this next practical that there's no complications. We've got plenty of time. The passenger's sitting down, they're conscious. There's no other complications. We're just going to give them the EpiPen because they haven't got their own, or it's something the doctors told us to get. Okay. So what we're going to do is we're going to quickly look through what we've got here. I'm going to demonstrate it for you, and then we're all going to have a go at it. Okay, don't be shy. It's going to be fine. So you can see the first thing we do, we get our EpiPen, we get it out of the tube, and then you see what we've got there in number 1. You'll get your EpiPen, and it's got a blue safety relief. It's like a cap on the top of it. Really important. That blue safety release has to face up. Blue to the sky. Blue to the sky, and then the orange bit, the bottom bit, orange to the thigh. Blue to the sky, orange to the thigh. So when we do this, remember which end is which. So the first thing we do, we remove that cap, if you like. Actually, first of all, we put our fist around it. And this is a big mistake people make. Keep your fist around it. We take the cap off, the blue cap, and we keep our fist around it. People tend to want to press their finger in the top as if you're pressing the nib of, you know, a pen to inject it. We don't. We just keep our fist around it, and we place it against the orange end, against the thigh, the outer middle thigh, because that's got a nice big muscle that's going to absorb that adrenaline. And you don't have to take people's clothes off to do this. You can do it through a jean. Just be careful you're not on the seam of your jeans, because a needle's going to come out, right? And make sure there's no change in the pocket or their mobile phone or something. We're going to push down hard until we hear a click, and that means the needle's gone into the muscle. And we're going to hold in place for 3 seconds. That's it, all right? So remove the EpiPen from the carrier tube. Let's pretend that's already happened. Okay. Form fist around the EpiPen, pull off the blue cap, place the orange end against the outer thigh, push down hard until a click is heard or felt, and hold in place for 3 seconds. And then you remove the EpiPen, you just take your fist away and you put it in the sharps container. So we're all going to do this. And what I'm going to do is I'm going to show you exactly how to do it. But we're not going to do it into our thigh because it's a bit difficult. Everybody's standing up and stuff. So first of all, I've got a Yoo-hoo stick. You can just pretend if you don't have a pen or something. So this is my EpiPen, blue to the sky, fist around it, all right? So I just want to see your fist around it. I want you to just take the top off, blue to the sky, place. Don't move your thumb. Keep your thumb there. Press. So I want you to go, I'll see that. I'll see that. Then I want you to go click. I want you to say click. Then I want you to count to 3. Click. 1, 2, 3. And all I want you to do is to see you to take it off. And I want you to say into the sharps container. Click. 1, 2, 3 into the sharps container. Okay. Want to go? Everyone up for it? Okay, Peter, would you like to go first? Sorry.
I was just going to say that the nurse should go first.
Ah, yeah, okay, let's do that, the nurse.
Let's see the professional do it.
Yeah, that's it, yep.
All right.
I'll tell you, whoever wants to go, put your hand up next, all right, after Carla. All right, off you go.
So I've got it in my hand.
Hang on, I've just got to check you off as you go on my competence sheet.
Yeah.
Okay.
So I'm pretending I've got it in my hand and I've got my fist around it.
Yeah,
Can you see it's a bit dark in my room?
that's
I'm going
good.
to take off the blue lid because blue to the sky,
Yeah,
orange to the thigh,
yeah,
and then I'm going to place it,
yeah,
and then I'm going to push down on it, hold
yeah.
it for 3 seconds, 1, 2, 3. Then I'm going to take it away and pop it into the sharps container.
That is brilliant. Does it make a sound when you push it in?
Yes.
What does it do?
Click.
Perfect. Click. Click. 1, 2, 3. Who's next? Nella. Sorry, you have to take your
I think
Okay.
you do a course on how to unmute first.
Okay.
Here is my EpiPen. Blue
Okay.
lid up, hand around, blue lid off, blue to the sky, orange to the thigh. Click, 1, 2, 3. Off it comes into the sharps container.
Brilliant. Carlos.
Really?
Go. Blue to the sky, go.
No, no tips. All right.
Orange to the side.
To the thigh. Carlos, that's upside down.
There, this way. I knew that.
Yeah.
1, 2, 3. And into the sharps container.
Lovely. Did it make a sound?
You did. Didn't you hear me? I said click.
I didn't hear that, but that's just me. It's a sound. It's okay. Who's next? Gabrielle stroke Anna.
Banana.
Banana. I'm allergic to bananas.
So a good grip, blue to the sky, orange to the thigh, press down hard, wait for the click,
Yeah.
and then put it in the sharps container.
Perfect. Perfect. Up next, it's going to be Dino.
Okay, so just like your one, I've got the little tube. So obviously, firm hand around the container.
Yeah.
Blue to the sky. Remove the lid. Basically, put it against and with a firm hold against the leg or thigh.
Yeah.
Until it goes click. Hold for 3 seconds. So 1, 2, 3. Release and pop it in the sharps container.
Perfect. Done. The next person will be Peter.
Okay, so I've got my EpiPen, firm grip, take the blue cap off, the blue to the sky, orange to the thigh, press hard till you hear a click, count to 3, take it out, then dispose of it in the sharps container.
That is it. That is perfect. And now we're up to, I think it's Joe.
Yeah. So the EpiPen here.
Yeah.
The blue top, take it out.
Yeah.
Keep it on your thighs.
Yeah.
Click,
Oh,
click,
oh,
click.
oh, 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 oh.
Orange to the down.
If I can just remind you, and it's my fault because I said don't press it like a pen.
Yeah.
We don't press it, and you've got a pen in your hand.
Okay.
So this is a problem that I've created by not giving you the correct equipment. So my apologies, Joe. But let's just remind ourselves that we just keep it in a fist the whole time.
Yeah,
Okay. Sorry about that.
Click,
Thank you.
Click, click. Yeah.
Yeah.
3 seconds.
Yeah.
And to the sharps bin. Yeah.
Absolutely. Thank you, Joe. That's great. And Mia, finally.
That leaves me, so I've got my tweezers here. I was improvising.
Gosh.
And hold it with a firm grip. Off, blue to the sky, orange to the thigh. I'm going to hold it in, wait for the click, and then I'm going to dispose of it into the sharps bin.
You are a legend. Everyone did an amazing job there. Thank you. Now, I'm going to go back. That is terrific. Thank you. Let's just move on to our next. Things are slowing up here. Let me just stop that for a minute and restart it and see if I can get it running. Okay. You know what? It seems like it's jammed, so I'm just going to quickly go and just run through this without the slides, if that's all right with you guys. Has anyone got any questions about that, what we did there? No. Okay. Look, I'm going to ask a few questions of you, and normally this would come up on the slides, but for some reason it's not working. First question: who can open the physician's kit? Anybody? Who's allowed? Gabrielle.
Only the CSM.
Correct. Just the CSM and nobody else. That's it. Excuse me just a second. See if I can get this down. It's amazing, isn't it? You practice all week, and before you know it, everything stops on the day. There we go. And I've got all the answers to your questions here. The next one, the CSM can only use certain items. Which ones are they? Does anybody know? The answer is right below it. Claritine is one.
The defibrillator.
Yeah, absolutely.
And the EpiPen.
Absolutely.
And Ventolin?
Ventolin, yeah.
Ventolin and nitrolingual pump spray as well. Our old favorite. Here we are, back again. No, it's jammed up completely. And Claritine is used for what type of allergies?
Mild to moderate.
Mild to moderate. And when would we use the EpiPen? At what point in the proceedings?
When they're having trouble breathing.
Yeah, when it gets real serious, right? Excuse me for keep running through these things here. Just trying to get everything else up as I go. And finally, who are you going to call if you got trouble?
Med-Air.
Med-Air. And anybody else?
Doctors in the cabin.
Yeah, absolutely. That's dead right, Joe. Any doctors available, that's what we'll ask for. So basically, those are our main key points. But the takeaway, which I would normally have up here for you, is that we have to be ready to manage any situation. We've just shown you a couple of perfect, no drama situations where we could easily administer the Claritine or give the EpiPen, and there's no other complications. We're not about to land, or there's other things going on. So as managers, we just have to remember to be prepared for anything. We need to know what equipment we've got, how to use it, when to use it, and when to step back and watch what's going on and organize and manage the situation. So are you ready for anything that happens at 38,000 feet now? You are. I'm very pleased about that, Gabrielle. I'll be on your flight next time. Look, what I'm going to do is I'm going to send out an email, a little quiz for you, which is basically on what we've done today. And once you've filled that out, I'll send you out that ASCIA sheet, which is from ASCIA, which is the Australasian Society of Clinical Immunology and Allergy, but we all knew that anyway, right? That's very handy to have on you. That's the official way to deal with stuff like this on an aircraft. Now, is there any feedback that you'd like to give me about today, apart from my slides not working?
I thought you did really good. I thought you did really good. That was very interesting.
Oh, good, because it actually went a lot faster than I thought. So thank you very much for that, everybody. I hope you did get something out of that, and I hope it's going to help you in your careers as managers. So what I might do now is just stop recording.